Welcome to our Beyond 20 campaign, a celebration of One Joshua Group's 20 years of service excellence. This is a One Joshua Group production, providing access to information and experts to help improve quality of life and health outcomes.
Thank you for joining us. We have tremendous opportunities to improve outcomes in a newly dynamic healthcare delivery, education, engagement, practice, and policy environment. It happens with champions, everyday people who choose to lead. Thank you for joining us. And thank you for celebrating our 20-year anniversary and beyond. We're excited to have joining us Dr. Valerie Montgomery Rice, who is the President and Chief Executive Officer of Morehouse School of Medicine. How are you, Dr. Rice?
I am doing wonderful. How are you, Kermit?
I am doing absolutely wonderful. Now, Dr. Rice, we read about Morehouse School of Medicine, and in that we learn in the forefront of the discussion about Morehouse under your leadership that the vision is to lead the creation and the advancement of health equity. Dr. Montgomery Rice, what does that really mean?
It's pretty simple, Kermit. It means giving people what they need, when they need it, and the amount they need to reach their optimal level of health. And what you will see over the next year is that we've actually expanded our vision, which is now leading the creation and advancement of health equity to achieve health justice. And we, after a year and a half of working through our next strategic plan and rethinking and evaluating what was happening externally in the external environment, social issues, economic issues that were influencing health outcomes, we ask ourselves, is it enough just to try to create equity? Is it enough to advance equity? Are we missing something? And something that we thought we were missing is really directly addressing those barriers that align with redlining or social policies or laws to some extent that really serve as barriers. And we thought that that was justice. If you can imagine those three people standing behind that fence, and they get to stand on boxes, and in those boxes, you can have transportation, you can have a job, you can have access to health care, you can have child care. But if you still have that fence there, they only get to look over the fence. What if we remove that fence and they actually got to run onto the yard or the playing field and actually play ball?
And Dr. Montgomery Rice, that's more than interesting. We spent all this time researching so that we could ask you the current questions. And it is so exciting to hear you talk about the fact that healthcare is not just how we take care of the physical and the emotional being, it is economic stability. You know where I'm going with that, all those concerns around the social determinants of health, being sure that we look at community context. Neighborhoods are just as important, and you did hear me use the word justice, important. So we're glad to hear and appreciate the expansion so that we really talk about the social and the justice issues. So when we look at social justice with the external factors, what kind of recommendations would you provide for those individuals external to organizations at the community level? How do we get involved in helping Morehouse School of Medicine and others like your institution reach the element of social justice?
So when I think about the social justice components, I am drawn to the decision that really recently came out, the SCOTUS decision about affirmative action. I've written about this in scholarly publications and given interviews about this. And it is very interesting to me that all of a sudden now, affirmative action, I shouldn't say all of a sudden, because this was a planned development, that affirmative action is not a tool that we should utilize to achieve equity. I totally disagree with this. And I will give this example. If you think about women in medicine, it used to be that men enrolled in medical school 3-to-1 to women. And this was early in the 1970s when you started to see a lot of work being done to increase the opportunity of young women to become interested in STEM, science, technology, engineering, and math, the sciences, so that they could be prepared to apply for disciplines like engineering and medicine at the graduate level. There was a concerted, organized effort by many of the federally funded agencies, state agencies, local and educational agencies to ensure that they had programs that were developed just for them, just for women, because someone recognized that if you're going to represent 50% of the population, you might ought to represent 50% of any profession that you have in this country. And now we can see the return on investment. We can see women applying to medical school at equal rates, and we can see now more women. And in fact, in the last 3 years, we've seen equal 50% women and men to matriculate in medical school. So a great return on investment, a great success story. So now let's look at the SCOTUS decision when it comes to race and ethnicity with affirmative action. So they're saying we cannot use race or ethnicity as one of the criteria for selection to medical school. Well, first of all, Morehouse School of Medicine has never had to do that, but I'll get to that. But let's get to the real issue here. They gave an exemption, right? They gave an exemption to the armed services, to the military, for the interests of the country. Because someone believed, I assume, that having diversity in the military is for the good of the country. Well, let's look at what's happening in the country with health issues. You have major health disparities based on race and ethnicity and gender, but more so based on race and ethnicity, gender, and socioeconomic status. Black and brown people are disproportionately impacted with heart disease, diabetes, hypertension, name it, cancer, maternal mortality. Black women have a higher rate, 3 times the rate as white women. So if you're talking about for the interests of the country, wouldn't you look at correlations? And one of the correlation is that when you have race and gender concordance between the provider and the patient, you have improved health outcome. So now clearly we want to eliminate health disparities. So clearly we need something in our toolkit that we can pull down, that we can actually control. And that is who is allowed, who is selected to become a provider of care. And those persons need to be representative of the country, because we know that race and gender concordance leads to improved health outcomes for the good of the country. And affirmative action is just a tool that you use, evaluating the data and saying, let us develop programs that increase the opportunity for Black and brown people to apply to medical school. See, one of the challenges that people have with affirmative action, they automatically assume that unqualified people are admitted. That's not what affirmative action is. Affirmative action says you must admit people who are qualified to succeed. Who are qualified to succeed. And Morehouse School of Medicine shows that over and over again.
So opportunity is an equalizer.
Opportunity is an equalizer. And just like education is that tool that's in that kit that I can utilize to increase my chances of being able to be healthy, because if I'm educated, I typically will have a higher economic chance and I will make different choices. Affirmative action is a tool that we can use to ensure that we are selecting candidates from these Black and brown communities who are qualified to compete.
So we've heard that opportunity is an equalizer. We've heard that access across the board are equalizers. And we also have heard you say that education is an equalizer. And I'm going to step back for a moment and talk about you and your journey to where you are at Morehouse School of Medicine. So you're a native Georgian. You were educated in Georgia, medical school at Harvard. Through Harry Medical College as a senior vice president, then dean at Morehouse School of Medicine, and president at Morehouse School of Medicine. Dr. Montgomery Rice, when did you know in your heart that you wanted to be president of an academic institution?
So I will answer that in a couple of ways. There were clearly other people who saw more in me than I knew that existed. Early on, as a young child in Macon, Georgia, I had mentors and sponsors who were charting a path for me that I didn't even know existed. They saw something in me because I clearly was a person who was disciplined. I loved school. I was willing to work hard, and they were willing to make the investment. And I figured out early on through the whispers of my mother that education could be a ticket out of Macon. My mother worked at a paper factory, and she rose to be the highest ranking woman working on the labor side of the paper factory. But that is not what she wanted for her 4 little girls. So she would talk to us about how education is your ticket out of Macon. And I remember that over and over again. So my goal was to do as well as I could in school and then to go to college. And from college, I didn't know what else would happen. I chose to go to Georgia Tech simply because my science teacher, Mrs. Newbold, said to me, "You're the only Black student in the honors program, and you like math and science. They're looking for Black students to become engineers. Why don't you go to Georgia Tech?" That was the extent of my college advising. And so I chose to go to Georgia Tech, and I majored in chemical engineering, having no idea really what a chemical engineer did for a living. I started co-oping immediately, and I co-oped with Procter & Gamble for 5 quarters, and they offered me a job. At that time, I started to have some insight and recognize that I actually didn't like being an engineer, but I loved math and science, and I wanted to do something that involved people. And so I decided to go to medical school. I chose Harvard Medical School because it was outstanding. I got into a lot of other medical schools, but once I got that acceptance letter to Harvard, I thought that that would be a game changer. And it was a game changer for me because it took me out of the South to the Northeast, and I got to really begin to understand and appreciate not just diversity based on race or gender, but diversity based on religion, socioeconomic status, right? Because there were people who were high economic status, there were people who were low economic status, there were people who were middle income, etc. But I got to experience what diversity actually looks like in all of its shapes and form. And I began to appreciate some things that you can control and some things that you cannot control. I really started to understand also at that time leadership. And what was gnawing at me early on was who gets to control the resources? What seat do you have to be in to control the resources? So as I finished my training and started practicing, etc., and people started to ask me, did I want to take on leadership roles? I was always thinking about what the next role was, not being a president, but at each level, you actually got to control resources. Now, control can be a negative word if you don't share it. And I was willing always to share that control because I wanted to make decisions that were informed by the stakeholders. And so at every level of my career, I have always been, I think, an inclusive leader who listens to what the stakeholders need, such that when I get the opportunity to make the decision on allocating the resources, it meets the people's needs. I recognize after I had become the dean and senior vice president at Meharry that if I really wanted the ultimate say in ensuring the allocation of resources to have their greatest impact, that I probably needed to be a president. And so it was a long time coming, and I evolved to having that interest. But it wasn't until after I had served in multiple levels of academia.
So we appreciate that, so that individuals understand it doesn't happen overnight. It's a journey. You have to recognize that each step along the way, that it is a pathway to something greater, but you've got to work hard. First chapter, Joshua tells you that you can have anything you want, but you got to work for it. It's not free, and you've got to earn to do those things. So we've been joined by Valerie Montgomery Rice, who's the 6th president of Morehouse School of Medicine. Dr. Montgomery Rice, you mentioned 2 other areas that we want to explore. And we're going to come back to you being a reproductive endocrinologist. We had a guest on an earlier show to talk about that. And we spent a lot of time talking about race concordance. We've not spent a lot of time talking about gender concordance. So I'm glad to hear you to mention that, because our staff here would be really excited to hear that part. And we're going to explore that a lot later. Stakeholder engagement, sharing resources, redirecting resources. What are the responsibilities of stakeholders to assist institutions like Morehouse School of Medicine, the city you live in, the state you live in, the nation you live in, to help us achieve social equity and social justice?
So, and I like social equity also. I will tell you, the stakeholders have to be committed to being engaged and not being afraid to speak up and to speak out, and to do it in a way that is not necessarily confrontational. My mother told me something a long time ago. She said, presume good intent until proven otherwise. So that's what I do. I presume that everyone comes with good intent until they show me otherwise. And so when I interact with my stakeholders, which is the community, the students, the faculty, just lots of different people, I always assume and presume that they're coming with good intentions, and it's not necessarily directed at something that is only going to be beneficial to them. That they've taken time to think through what it will mean to other individuals also. And then we can work together to co-create a solution that will have benefit to them and to a broader audience of individuals. That's what I think is so important as a stakeholder. I also ask a stakeholder to come with your authenticity. Come with who you really are. Don't be afraid to share your story. I came from a family where my parents divorced when I was 6 years old. My father was abusive, and my mother took us out of the house unexpectedly for all of us to save us. And I happened to be in the hospital during that time with osteomyelitis. So I left from a home, was in the hospital for 3 months. And when I came back, we were in an apartment sleeping on the floor with some mattresses. And I was about 7 or 8 years old, not knowing what had really happened. For many years, I didn't tell that story because I felt possibly some responsibility to this. I didn't really know that I could explain what had happened. But as I matured, I understood that every family has challenges. It is what you do through that challenge, the resilience and the grit that you gain from those lessons learned, that helps you to be a contributor to solutions that may be of value to someone in the community, but solutions that may be of value to you. And so I tell people, don't be ashamed to tell your story. Everybody has one.
Yeah.
Everybody has one.
So you led me to story, and I'm going to tell one of mine. The first time I met Valerie Montgomery Rice, and she always says I don't remember that, but that's because that's who she is, that she wouldn't remember that. We were producing a program here. It was actually a Morehouse School of Medicine program, a primary care conference here in Atlanta, and there was a little boy. He could have been no more than 3 or 4 years old, and we were in the hotel, and he was running across the hotel, and he tripped up and fell. Now, I have to tell the story as I remember. Dr. Montgomery Rice had on high heels this high. The child ran across the room and fell. Dr. Montgomery Rice reached down and scooped the child up before the child hit the floor. She'll tell you she doesn't remember this, but I do. I was so impressed by someone who never broke a stride of purpose to be repurposed for the moment. So I told her then, if there's ever anything that I can do, you call me and I am more than willing to do that. And I think she tells that in her story, that we have to find the purpose and we have to repurpose so that it is appropriate. And that being said, Dr. Montgomery Rice, do you really think that social justice is achievable?
I actually do. And let me tell you why, Kermit. When I look back and think about what was happening 400 years ago with slavery and people being taken from their homeland, tossed on the ships, brought to a foreign land, enslaved for generation after generation after generation. What gave them the strength to keep going? What happened in the hearts and minds of those persons who were enslaving them over time, who recognized that there was a wrong being committed? I believe in the redemption of people and the redemption of the soul. I am a person of faith, and I do believe that social justice is attainable. But it doesn't just happen passively. It takes constructive activism. It takes dialogue. It takes attention to policy. It takes education. It takes reform. It takes repenting. It takes saying, I'm sorry and I was wrong. And then it takes ideas and plans about how to right the injustices. And those plans must be inclusive of those persons who have been persecuted and those people who persecuted, so that people can come together and make sure that it doesn't happen again. I believe that dialogue happens in small places every day. And at some point, all of those circles are going to connect, and we will see an explosion of what we describe as equity, not just health equity, but equity that leads to health justice and justice that leads to opportunity. So yes, I believe it is possible. I pray for it every day, and I work towards it every day.
And Dr. Montgomery Rice, I have a number of questions, but I don't think that there's any other way to end this discussion than what you just shared with us, except one more question. Who is your star, and who has influenced you the most to help you achieve this holistic, spiritual, purposeful approach that you've undertaken?
There is no doubt in my mind that it's my mother. She has been my shining star my entire life. She is who I strive to exemplify as a woman of faith, as a woman of courage, as a woman of grace. I fall short a lot of times on the grace, but I think she would be proud of me from the courage perspective. But she is my shining star.
So we've enjoyed the information, the fellowship, the guidance, and the direction from the sixth president of Morehouse School of Medicine, Dr. Valerie Montgomery Rice. She's told us that we should be holistic in our approach, that we should be inclusive, that we should advocate, we should be purposed. And I did hear her say that not only should we coach, but we should be coached, and that we should pick a shining star that helps us guide our direction, that follows our heart. Dr. Montgomery Rice, thank you so very much as we celebrate our 20th anniversary and beyond. And thank each of you for joining us. We look forward to you joining us in our future podcast. Thank you so very much. Remember to be kind, be compassionate, and to be thoughtful.
And Kermit, may I say congratulations to you all for 20 years of your care. The One Joshua Group has been one of the most impactful organizations that I had the opportunity to work with at Meharry, through other organizations, and now at Morehouse School of Medicine. And they are impactful because they first care. So thank you and congratulations.
This edition of Beyond 20 is a Life Beat podcast sponsored by One Joshua Group, your strategic source of engagement to improve life through better health, education, and information. For more information, visit us at theonejoshuagroup.com or follow our work on LinkedIn, Facebook, Instagram, and Twitter using hashtag OneJGCollabs. One Joshua Group, building capacity, expanding resources, joining what you know with what we've learned.